The second most common GYN malignancy is ovarian cancer and is the leading cause of death in this category because of misdiagnosing as a complex cystic mass. First image, a hemorrhagic cyst is a functional cyst that results from bleeding into a Graafian follicle or a corpus luteum. It typically appears as a unilocular cyst with internal echoes and fine septations. The cyst wall may show increased vascularity on color Doppler. The cyst may also have fluid levels or a reticular pattern due to fibrin strands. Hemorrhagic cysts usually resolve spontaneously within a few menstrual cycles. Second image, a mature cystic teratoma, also known as a dermoid cyst, is the most common ovarian neoplasm. It contains elements from multiple germ cell layers, such as skin, hair, fat, bone, teeth, etc. It usually appears as a cystic mass with a hyperechoic mural nodule, the Rokitansky nodule, or dermoid plug, which represents the solid component of the tumor. The cyst may also contain echogenic sebaceous material, hair, and calcifications. The most common characteristic sonographic feature is the tip of the iceberg sign, which refers to the obscuration of the deep structures by the highly echogenic anterior wall of the cyst, commonly mistaken for bowel. To nerd image, a cystic neoplasm is a malignant ovarian tumor that arises from the epithelial cells of the ovary. There are different types of cystic neoplasms, such as serous, mucinous, endometrioid, etc. They usually appear as multilocular cysts with thick septations, 3 AIM, papillary projections, solid areas, and mural nodules. Solid components may also show increased blood flow on color Doppler. While benign lesions can be very large, the likelihood that a lesion is neoplastic increases with size. Lesions with thin walls are more often benign, and lesions with thick, irregular walls are more often malignant. However, there is some overlap, making wall thickness a less useful criterion. For example, a corpus luteum cyst may also have a thickened, vascularized wall. Large quantities of ascites, lymphadenopathy, and peritoneal deposits are strongly associated with an increased likelihood of malignancy. Postmenopausal women should raise suspicion.